with C3 Collaborating for Health. We have a series of international seminars where we invite somebody with expertise and experience from another country to share their experience more widely. We used to have them with wonderful fresh breakfasts that we made ourselves. But now, of course, everybody's having their breakfast virtually. Nothing like so interesting, but enables us to reach many more people. And of course, it enables us to have a speaker from countries from different time zones without all the hassle and cost and problems of travel. So today, I'm really pleased to welcome Stephen Aguino. C3 has been involved for just over a year in a global oral health project. Oral health it's almost a no-brainer that, of course, what goes through your mouth is fundamental to your health and fundamental to our core work, which is the prevention of chronic disease. And we met Stephen through a global steering group of nurse leaders around the world, which we've been working with for almost the past year. So I'm going to hand over to Stephen so he can introduce his background and his interest as he tells you the realities and opportunities for all of us on oral health. Stephen, you're very welcome.
Very much, Crystal, and a very good morning to everyone. So I'll probably start from a bit of my introduction and then jump right into it. So my name is Ogwena Stephen, as has been introduced by Christine, and I'm a public health nurse with a background in public health and master's in global health from the University of Manchester. Besides that, I work a lot in the chronic diseases space, in the non-communicable diseases space, both locally and internationally. And locally, I run an organization called Sterling, and that focuses on chronic diseases and young people. And then internationally, I also work with a few organizations sitting in various committees, including with the World Health Organization, NCD Labs, the FBI, and also the Non-Communicable Diseases Alliance under our Views, Our Voices project. So, well, today we're here to talk about oral health, something that's very close to me, and we will talk about that in a moment, but also something that I think needs to be talked about more often and more loudly, especially for us working in the global health, public health space. So without further ado, I'll take us through a bit of an introduction to what is oral health, and then we will look a bit also into what we can do about oral health, and then finally, we will conclude the discussion with concrete action points and examples where oral health progress is going globally. So very simply, what is oral health, and why should we be concerned about oral health? So oral health refers to the health of the teeth, gums, and the entire oral facial system that allows us to speak, smile, and chew. And when you look at oral health in the broad spectrum, it's not only about the teeth, it's also about the gums, also about the bone density in the facial system, but also it also speaks to what it can help us to do, which is to engage, to interact, to speak. And I'm sure if some of us have had toothache at any point, then you know how oral health is important, because when your tooth is aching, you literally can't do anything. You can't smile, you can't speak, you can't eat, you can't chew, you're probably irritated, and a host of other things as well. So what are the most common oral health diseases? And some of the most common oral health diseases that probably all of us may have experienced or have someone experienced before is tooth decay or cavities, gum diseases, which of course is called periodontal diseases, and oral cancers. These, pose as some of the most common, most known oral health conditions. Now, moving forward, I sort of like to bring an angle on oral health and non-communicable diseases. We all know that non-communicable diseases are diseases that do not transfer from one person to the other, often referred as chronic diseases, and they are long-term. And so oral health and oral diseases have been classified as part of non-communicable diseases. And this is one of the first important points that I hope we remember, because as I continue, I'll be referring to oral health as a non-communicable disease. And the reason why it is a non-communicable disease is because you can't transfer it from one person to the other. It often occurs over a long period of time. And that is why oral diseases are part of non-communicable diseases. Oral diseases are also closely related with other non-communicable diseases, as we will see later in the topic. And we will see that if you have poor oral health, you are likely to increase your chances of getting certain types of cancers, certain types of cardiovascular diseases, and we will talk about that as well. And then gum disease increases the risk of developing heart disease. As an example, people with diabetes are also at a high risk for developing dental cavities. And if we see that oral health, the oral diseases and other NCDs share modifiable risk factors. And this is very important because this really solidifies oral health and the NCD's agenda. You find that oral diseases all share tobacco use, all share harmful use of alcohol, all share unhealthy diets as some of the risk factors that lead to oral diseases and also non-communicable diseases. So moving forward then, oral health and maternal child health. That is the another angle that I want to bring forward before I start to get into the details. And oral health and maternal child health are very, very closely related. And if you have bad oral health in pregnancy, um, pregnant women can experience premature delivery, low birth weight for the baby, preeclampsia, tissue ulcerations, pregnancy granuloma, and a host of other diseases, including losing teeth, mouth dryness, and dental erosion. And for a lot of people, this is new information, but when you see it from the mothers who experience oral health challenges and their teeth are either going through cavities or periodontal diseases, you tend to see this in real life, and it's really a sad state, because these mothers experience a lot of pain uh, in terms of their oral health, and they cannot eat, they cannot have the right food, and that in turn also affects the child. But you also see that poor oral health in children themselves, and especially when they are born, affects their physical, mental, and emotional well-being. And it goes just beyond causing tooth decay and gum diseases. In fact, it could lead to terminal illnesses like heart disease, dementia, and respiratory diseases. And if anyone in the participants has ever had, let's even take cavities, tooth decay, as a child, you see how it could lead to more than just the physical effects and the pain, because mentally you can't focus, emotionally you are stressed, you are sad all the time. It affects your self-esteem because now you can't talk to your friends, and in fact, it could lead to a host of other terminal illnesses when not taken care of. Before we join this call, we're just talking about oral health and a recent article in The Guardian, I think today, and how it is difficult to access oral health services and how it is expensive. And that brings us to the realities of oral health. But at this point, I want to iterate what I've just talked about so that we are all on the same line. So we've talked about the definition of oral health, and we've talked about it being affecting the teeth and the gums, and we've talked about common oral health conditions. And then we've talked about relationship between oral health and NCD, and we've discovered that oral diseases are closely related to non-communicable diseases in the fact that they are all long-term, they all cannot be transferred to one person to the other, and they all share similar characteristics. We've also talked about oral health and its relation to maternal and child health. And we've seen that pregnant women who experience oral diseases have various complications when they give birth, but also children in their early life stages, when they experience oral diseases, are also affected in different ways. And now we want to talk about the realities of oral health. This is one of the topics that perhaps I feel needs to be discussed more in the public health space. So what are the realities? How is oral health actually in the field? And one of the things you see, Nature is a very verified public health and global health publication. And they say that oral health has been overlooked. Nobody wants to look at oral health, and for the longest time ever, it has been one of the most underlooked topics. Oral health is a public health challenge, and that is from the Lancet. And that article that talked about oral health as a public health challenge really went into details to show the problem when it comes to oral health, especially across the lifespan. The World Health Organization says that oral health is in fact expensive, and accessing oral health services is really expensive. And those are the realities on the ground. It has been overlooked as a topic. It is a public health challenge, and it is very expensive to take care of. And when you look at that, when you start to look at the realities of oral health, some of the things you begin to discover is the questions on affordability, that how do people access oral health services, and how do people access the services? Are they available? Are they affordable? Are they accessible? Can you walk to any hospital and access oral health services? But also, the other thing that I think is very important, because it is a non-communicable disease and it affects you over a life course, is the continuum of care. Is it available? And when you go to the ground, you will discover very quickly that oral health is not affordable. Oral health is not necessarily accessible, and it really lacks in the continuum of care. In fact, a lot of focus on oral health is between the ages of 0 and 5 years old, when you're being taught how to brush your teeth. And then after that, nobody wants to, or there has been a low access to continuum of care afterwards. And if you have an oral disease or oral health challenges, the continuum of care is lacking. But if it is available, it's not, it's expensive and it's inaccessible. So let's talk about accessibility when it comes to oral health. And the first thing you'll see is that dental services are a thing for the cities. And I put a thing there in Italy to emphasize that most of the time, oral health services are mostly accessible in major towns and cities. And once you move out of the major towns and cities, it's very difficult to access a dentist, to access a specialist in oral health, and to access the relevant services in oral health, both in public hospitals and also in private hospitals. Secondly, is there's a huge gap between the high income and the low income social economic divide, that the people in the high end are able to access these services because they have the financial power to do that. And the people in the low end cannot be able to access because of finance, but also because of access. Because if oral health services are mostly in cities and major towns, low socioeconomic people who live in such low socioeconomic areas do not primarily live in town. And because of that, they don't access these services. And then there's very few options in the public health facilities to address oral health care. And this is a reality that I experience on day to day on the ground, that when you move through hospitals, and especially if they are government sponsored, and especially if they are in developing nations, then there is very few options for oral health care in the public facilities. Even if you're living in the West, Some of the first options you are given when you present with a cavity is extraction. And nobody tells you that they could be filled or they could be cleaned up, and there is things like root canal treatment. You don't get any of that. Primarily, like the options that exist in this hospital is we extract. If you present with this, we can only extract and hope that you're able to carry on with that. And or we could make you denture after extraction. So there's already a few options in the public health facilities. When you look at affordability, then you'll first immediately see that dental services are very, very expensive. And it's very hard to access these services. But also the other thing you quickly notice is that affordability when it comes to oral health is in terms of health insurance. And most people across the globe, when they present with oral health challenges, either the coverage is very small, or in many cases is non-existent. Oral health services are not primarily covered in many insurance plans. Thirdly, is that oral health and they are associated, there are other associated costs that are not covered either with government insurance and you have to pay out of pocket. And these include the drugs, the transport to these facilities because they are very scarce, and maintenance of your procedures if you had your teeth replaced, and there's maintenance costs as well. And so it is not, affordability is not just about the cost of treatment or the cost of the services or the cost of extraction or the dental or the root canal. It's also the cost of the drugs that you pay out of pocket. It's also the cost of transport that you will use to go to these facilities. And it's also the cost of maintenance once you've had these procedures done. And most of the time, these are not easily accessible, making oral health expensive. Thirdly, we look at continuum of care. So I've gone to the hospital, I've presented my case of dental caries, and they've either replaced my teeth or extracted it, which is the more common option, and given me a denture. And so what is the continuum of care? You'll quickly realize that there is a few specialists trained in the oral health space to help take care of you after you have the services. There could be dentists, yes, to take care of you when you need the primary services, but after, very few specialists exist. And then for oral health, it's very transactional that there is very low follow-up for any services. So once you get your services, once you get what you had to do, either it was a replacement, it was an extraction, it was a cleaning, it was a filling. After that, most of the time there is close to zero follow-up services for oral health care, as opposed to many other diseases that are followed up over a period of time. And then you would also notice that there's a few options for treatment and care, as a result affecting the continuum of care. So because of few options for treatment and care, going back to access, and then also because of a few specialists, when you get the procedures done, the reality on the ground is there is very few options for you to access care and to follow up that with treatment over the life course. Because again, oral health and oral diseases are very much non-communicable diseases that require care across the life course. So those are the realities on the ground. And what opportunities exist? And I thought I'd talk about this slide with my own experience with dental diseases. So on the pictures, you'll see that this is me this year actually, and actually a few months ago, when I presented with a very severe oral health condition. So my my teeth began to decay very rapidly because of procedures that I had had in the past. And very quickly, I was in a condition where I needed to extract 9 teeth and get them replaced, or get root canal treatments for 9 pairs of teeth. And all of a sudden that became very expensive because again, oral dental services and dental care is very expensive. That's the reality on the ground. And even once you've had the services, the follow-up is almost non-existent, which is what I'm now experiencing at the moment. And also the uptake for services and the provision for services is also non-existent. And so when you look at here, this guy was in serious pain for a series of months, trying to raise funds for himself to be able to, get some of the primary procedures done to get me out of the room. And so when I talk about oral health, it's something that I experience on a day-to-day basis, and the challenge was there. And this year I had to have, for example, 6 pairs of teeth now, taken out, done for root canal and replaced, and that was expensive, and that service was inaccessible because I had to travel all the way to town and look scout for dentists who could be able to give me the service that I wanted, and also nobody follows up. Those are the realities on the ground. But enough about what we can complain about and what the realities look like. What are the opportunities? What exists? What can we actually do when it comes to oral health? So what opportunities exist for us to be able to take the next step in beginning to improve the access, the affordability, the continuum of care for oral health services? So the first thing is embedding oral health care into education and practice. That is one of the things that we could primarily do, and that is an opportunity that exists. And second thing is making oral health care affordable and making it accessible. And the third thing is role of policy and partnerships. So you notice that I structured this in things that we can do at individual level, and then I end it with policy, which is what we can do at a more national level. So let's get into it. Embedding oral health care education into practice. And when I'm talking about oral healthcare education, I'm talking about including oral healthcare education in patient briefs as the first point. Most of us joining the call are practitioners and public health specialists and doctors or nurses. And when we are giving our patient briefs, putting 1 to 2 minutes of oral health education into the patient brief goes a long way in ensuring you are giving more wholesome services, because again, oral health is already a public health problem, and we can contribute by very simply committing an extra 2 minutes in our patient briefs to also talk to them about their oral health and what they need to know about their oral health care. The second thing is using uh, visual oral health guides in all facilities. And here is the thing with visual. Human beings will learn by seeing more so than by reading. And so when you see something, you're more likely to remember it as opposed to when you read it. And when you use visual cues and visual illustrations and infographics in health facilities, then you're able to educate our communities on oral health, even without having to talk about it. We're able to nudge them to want to learn about oral health, and this has been a proven formula for many other diseases, including HIV, diabetes, alcohol, tobacco use, and that is something that we could pick and use for oral health as well. And then thirdly is community and facility education programs need to include oral health care. So in this point, I mean, when you are training community health workers, when you are training medical staff and facilities, both in post-training education, but also even during the university education and further, we should include more oral health education to ensure that they are aware and they are informed. So a few weeks ago, we were talking with some of my doctor friends, and they're still in campus. They're learning about various parts of medicine, and the discussion around oral health came up because, of course, of my current predicament with oral diseases. And so when I asked them what they knew about oral health and oral diseases, and if they could give me any practical advice, you could see that they struggled because, again, this is not primarily taught to them unless then you go and want to become a dentist. And this, I insist and I would really suggest that it needs to be more educated in institutions, and so that our medical facilities, our public health specialists, our community health workers, our community educators also know about oral health, and they can, as a result, educate other members in the community about this. Next, we look at making oral health care affordable. How do we do that? And one of the things is train more specialists. The reason why oral health services are expensive is because there are few specialists, and so they are in control of their market, and sometimes they monopolize the market and put the prices however they want because they know they are the ones who are there, they control it. And so one of the things is, if you're able to train more specialists in oral health, then you're able to bring the costs down. The second is show various options to the patients. As doctors, as practitioners, as oral health educators, we need to tell our patients that extraction is not the only option that exists. You know, that there are other things like filling, there are other things like canal treatment, there are other things like dentures, and even with dentures, there are different options. There are other options that exist that you could take into consideration before removing your teeth. And when there is options, patients can be able to see what options they can choose, independent with what they can afford, but also dependent with its impact across the lifetime. And this, I think, is very important for us as practitioners to continuously ensure that we're showing our patients the various options that exist. And I mean, even for myself, when I was growing up and I had my first two premolars extracted, when there was options of filling, if I had known better, I'd probably say, okay, maybe just fill them up and not primarily remove them. And that speaks to the point of having various options. Thirdly, is offer preventive dentistry. And preventive dentistry is really a focus on educating communities and educating the patients that we serve and the people that we serve on how to prevent oral health and oral diseases before they occur. How do you ensure that your teeth are strong? How do you ensure that your teeth are safe? How do you ensure that you're able to take care of your teeth over the long term? Do you know how to brush your teeth correctly? But past that, do you know why that is important? So offering preventive dentistry becomes one of the more important ways in ensuring that we don't end up having these diseases. And if we don't have these diseases, then we don't need to pay all the exorbitant costs that come with treating and managing these diseases. And then finally, show our patients that there is phased treatment. Phased treatment to say that if I have a service, I could come and have the first part of it addressed. And now I don't have to pay the whole sum of money if I don't have it to be able to take care of my, oral diseases and treatment. So show that you could come, you could potentially have treatment in different phases. And this is true for oral health. You could have phase one where the most important parts are done, phase two, where the next steps are done, phase three, management. And for the patient, you now have the option to pay in bits rather than collect the whole sum and pay it in once, which looks more expensive. And so in making oral health care affordable, we should also highly provide phased treatment for our patients. Then lastly, what is the role of policy and partnership? One of the roles is including and improving insurance coverage to cover oral health services. And as health educators, as researchers, we could potentially produce evidence to governments to show and to argue for a case to improve insurance for oral health and to include it in universal health coverage and also other health insurances. And that is our role. We could be able to show evidence so that policymakers could be able to have that included, and improved for the citizens. The second thing is state laws to regulate pricing of oral health services. State laws could potentially regulate the pricing of oral health services to ensure that whether you are practicing in private or in the public settings, you have, you can't overcharge the patient and you can't overcharge for your services so that the services are within a range and people then are able to access more services. There is examples in the United States and in a few states where this has been done and oral services have been, the prices have been regulated, and this could be best practices that we pick moving forward to ensure that even for us, then we are able to regulate these services. But thirdly is leveraging on partnerships to improve oral healthcare. Nothing currently is more important than partnerships because people are different, people are strong at different areas. And with partnerships, we are able to avoid repeating the wheel or avoid creating the wheel. And partnerships also ensure that we as advocates, we as ambassadors, we as public health practitioners, we as nurses have the opportunity to come together and speak from a point of strength, leveraging on our partnerships to influence some of these policies, but also to influence the care that we provide for the patients. And so the role of policy and partnerships is very important because if a policy is implemented, like the regulation of prices, it affects the population it affects the people at a population level, and the whole population gets the benefits of that, and that reduces inequality. Partnerships could also help in reducing inequalities. And the next, I'll try to look at what are some of the examples that have existed to show that there's actually some movement in the oral health space and movement in terms of policy and partnership. And I think in 2011, for advocates in the oral health space, we had a pivotal moment when the United Nations Political Declaration on Non-Communicable Diseases highlighted that non-communicable diseases do not exist in isolation from oral health, and that these two can benefit from a combined, comprehensive, and integrated response. At that point, oral health suddenly came into the limelight. And as practitioners and enthusiasts in the oral health space, we began to see that there could potentially be a change in terms of priority and in terms of focus in the oral health space. I mean, the progress for that was a bit slow, but 10 years later in 2021, during the World Health Assembly, the 74th General Summit, there was a resolution on oral health. And this resolution called for a global strategy, an action plan, and targets for 2030 and best buys for oral health. And we will begin to see that 2022 and moving forward, organizations like the Global NCD Alliance, the World Dentist Federation, and other organizations are already beginning to work on this global strategy, and they're already beginning to produce this action plan to ensure that by 2030, we have better policies and better best buys for oral health, ensuring that we're able to put oral health at the hands of the people, and we're able to provide these services. And then finally, in concluding, what are the three key points that we could all take from this short presentation on oral health, its realities on the ground, and the opportunities that exist? One is we need to put more action in oral health education. We know that we can do it. We on this call, for example, are the ones who are informed. We need to put more action in ensuring that in our practice, in our services, in our delivery, we are able to include oral health education. Secondly, is we need to advocate for our patients, and we need to ensure that their voices are heard. We are the ones in authority. We are the ones who have influence and power. And through research, through advocacy, through offering policy suggestions, we could potentially be able to advocate for better services for our patients, including the reduction of prices, the coverage under UHC or other health insurances, and also ensuring that patients get a continuum of care when it comes to oral health. And then finally, we need to lobby through research and evidence for better inclusive policies. Again, iterating on the advocacy part of it, because we as the practitioners, we can do research. We can show evidence that oral health is important, that oral diseases are a public health challenge, and that we need better services in our hospitals, in our counties, in our states, and in our nation. That is a role that we could potentially do. And so that is how I'd like to conclude this short presentation on oral health. And before I invite us for questions, I'd also probably like to share a final call to action from my end is that as practitioners, as organizations, as individuals, we have some power and some authority to potentially create a movement and a change for the patients that we serve in the oral health space. And so we need to take that up. We need to stand up with our patients because, again, we are the most trusted. Nurses and doctors and the public health specialists are some of the most trusted professionals. And with our trust that the people have put in us, we could potentially make radical changes to ensure that our patients and our services and our communities get better oral health services and better oral health information over the life course. And with that, I'd like to now welcome questions that we could potentially discuss and that we could also potentially look into. And so I don't know how we handle questions in this session. Does someone unmute and speak, or do we text that in the chat box and respond to that?
That's great, Stephen. Thank you. Thank you very much indeed. And we already have at least one question in the chat. I've got a few that I'd be interested to ask you, but perhaps people can either put a message, a question, a comment in the chat, or put your yellow hand up on the using the reaction icon to find a hand so we know that questions are coming. So Michaela Nuttall has a first question, probably a similar question that lots of people might ask. Michaela, over to you.
Lovely, thank you very much, and thank you, Stephen. I'm just going to say a little apologies. My computer rebooted itself in the middle, so I missed a little chunk. So apologies if you have already covered what I'm probably the first of many questions, because I do ask a lot. A nurse, a cardiovascular nurse in the UK, and I work with Christine at C3 as an associate in nursing. And my first question, and then I'll let it go back to others, and then I'll come back maybe to some more, is as a nurse who's predominantly in the UK, but interested in cardiovascular disease, of which oral health and prevention of cardiovascular disease, of which oral health obviously is key to that, but not very well known. What can I do as a nurse in the UK to help others who possibly don't have the same potential level of oral health care that we do? So what can I do?
Yeah,
good question. Stephen, over to you.
Question, and I sort of love that the fact that it's very action oriented. What can you do? And so I'll probably go to the very last slides, but one of the things that you could do, because you know the relationship between cardiovascular health and oral health, your patients do not primarily know. Your co-workers might not necessarily know. So one of the things that you could already primarily do is to educate them. So, and especially educate the patients and the workforce that you work in to already know once they know, they then could be able to potentially educate other patients and educate other members of their communities. And that is how information spreads. That is the first thing that you could do. The second thing that you could do, and especially as a nurse interested in cardiovascular disease, is to use your knowledge and influence in the cardiovascular disease space, which I'm sure you are more knowledgeable in, to produce, policy briefs, articles, opinions that could then, be cited as evidence that could then use to push the message forward. So that could be another thing that you could potentially do. And then I think the last thing that you could do is to simplify this information, because again, there's a big gap between us who know and the members of the community, that we know the technical jargons, oral health, cardiovascular disease. The members of the community might not necessarily know all of that. So how do we simplify this education to ensure that even as we share it out, the people can be able to consume it? And I think that is also something that you could do as a nurse.
Yes,
Thank you. And hold on, Michaela, you can come back later, but we have a question in the chat from Glenn Stewart, who's a long-term friend of C3. Glenn, unmute yourself, tell people a little bit about who you are and where you come from, and then start. There are several questions I think you put, but start with them and see how far you go and how Stephen gets around to answering them. Glenn, over to you.
Thanks. Well, I work in public health in Enfield, but I'd be really interested in, I know in some families, you seem to have some people, even within families, some people seem to have teeth that are indestructible and some that seem to fall apart as soon as they open their mouth. What's that? What are your views on fluoridization? How people can be encouraged to clean their teeth? And to be honest with you, I know this is ignorant. In some places, I don't even know how people clean their teeth. So I imagine in some areas where toothbrushes aren't particularly around. So just some thoughts around those would be helpful. Thanks.
So sort of three questions, I think.
Yeah, sorry.
Some
quick.
Why do some people get good luck with their teeth and some don't? What about fluoridation? And what about areas where the sort of simple, straightforward, clean your teeth morning and evening routine that some of us have been brought up in, where there aren't any toothbrushes, there isn't any toothpaste? What are the issues there? How about that, Stephen? Over to you.
Yeah. So, well, the first one was on, why do others get good teeth and why do others get not so good teeth? And I'm among those others who didn't get the good teeth. Yeah. So, what is my opinion on that? And so I guess the thing is, we have to explain to people why that happens. And there could be, potential explanations to why that happens. One of them could primarily be genetic, that it just happens that you are born, genetics that do not support strong teeth. And it could be also because of, again, childhood, pregnancy, and dental health issues. As we had looked in the first slides, is that when a pregnant mother has already dental challenges, it's very primarily likely that the child will also have that. But then is environment, because besides the genetics, the environment that you exist, the water that you drink, the food that you eat, and what might be considered normal to you could be affective to your health. And so how do we communicate those different circumstances to people so that they know, well, you might be having imperfect teeth because of this and that, but also changing the narrative on what perfect teeth is. Because for some, perfect teeth is that they're functional, they're strong, they're white. For others, functional teeth is aesthetics. And so how do we also change that narrative, I think is a conversation that we need to have. And then you also asked about my views on fluoridization and what I think about it. And I think the issue with fluoridization is also very much an issue of what do you know about it? Because again, a lot of myths, and I'd probably be one who was affected by some of those myths, is some of the questions, some of the things that we used to be taught is that when water is fluoridized or when it tastes a certain type of way, instead of it preventing dental decay, it leads to tooth decay. And we didn't know any better because anyway, that is what used to go around. But you see that if it is implemented, it helps prevent dental decay at a population level. And I think such are the interventions that could potentially make an impact at a population level, and especially in low and middle income countries, as things that potentially could be adopted. And then the other question that I think was interesting is when you're raised in an environment people think you and you necessarily do not have a toothbrush, how does that look like? Well, I thought that question was interesting because if you're brought up in an environment where you are told you're supposed to brush teeth in the morning and in the evening, most of the time the expectation is that you have, access to either toothbrush or toothpaste. But again, the thing that I would say is alternatives. What alternatives exist? How can you brush your teeth without toothbrush and toothpaste? In Kenya, for example, where I come from, I'd give you a very clear example that people use figs from certain trees to be able to replace toothbrush, and I see that also happen in the UK for some time. Other friends are sharing that with me, so it could be a practice. You could, if there is no toothbrush, you could use the barks of certain trees, or that as alternative. And there is no toothpaste, you could use salt, or there is also other alternatives as well, like ash that have been used to clean teeth and whatnot. So again, it's the question of what do we know as what do we primarily know? We know that toothbrush and toothpaste is what we could also use, but there is a lot of other alternatives that exist that if we knew about them, we could also educate other people that you primarily do not necessarily need a toothpaste. You could use this to replace that. If it's not there, as a result, then ensuring that more people then get to take care of their health, dental health, whilst not primarily having, what would be termed as mainstream toothbrush, toothpaste narrative as the key to taking care of their oral health.
Thanks. Michaela, you had another question, I think.
Did, and actually I also, it was being picked up, Oscar's put something great in the chat, and it's been a while since I've been a nurse doing handover or giving sort of direct patient care in hospitals, but I don't remember at all making much of an effort for talking about people's teeth during handover. I certainly remember making sure that people cleaned their teeth. And I know that sounds daft, but making sure patients in hospitals had access to a little pot of water and giving them their toothbrush and stuff. I suspect that's slipped a lot in nursing now, in nursing care, because partly through time and pressures and stuff. So yeah, I wonder how we can make sure that we can influence that way. Also, my other bit is, let's go back to I want to sort of ask you, pry you a little bit on the role of then dentists and dentistry, because we have, in the UK, we have lots of let's make your smile brighter and come and get your teeth whitened. There's a big thing on getting them straightened, and you buy your little clip-on braces and stuff. So people are obviously interested in their teeth a lot, but how can we sort of engage with those people who are providing those messages of come and make them look more beautiful, to really, and how important is it that impact will have on your health? And I'm not sure that's a question, or maybe, but yeah, it's just, we have this huge fascination with teeth to make them look as beautiful as they can, but without wondering about the impact that they have. Is that?
So, well, I have a few comments on that, and I'm also a victim of that. So maybe let me start from there. That because I was born with what you call the bad teeth, or like I was unlucky when it came to the teeth department. And you see all the adverts everywhere wanting you to have these perfectly shaped teeth, white and whatnot. That is very misleading, and I think that is where the conversation on regulating dental health services, which I talked about earlier on, begins, is what counts as a normal human teeth. And when you look at them, when you look at the pictures of what a normal human teeth look like, is, well, there is all the pearly whites, which is the lucky one, but also there is everybody else. Some have bigger molars, some have bigger canines, and some are a bit disarranged. But that is what normal looks like. And I think it's our role as practitioners and dentists to start to show our patients that this is also normal, and normal does not mean straight and well chiseled and pearly white. In fact, the normal color of tooth is almost, it's inclined towards the yellows, and not like pearly white teeth. So that is where we start. So again, breaking down those myths and those perceptions that have been sold to us, I think would be a good first step in beginning to ensure that more people feel more confident about their teeth, because eventually what this pearly white chisel teeth does to us is they tell us that they make us unconfident with how our teeth look. And as a result, we want to stick to something. I think that is one of the first things that we could do. And then the other thing that you mentioned on the role of the dentist is when it comes to this messaging and education. I think one of the biggest roles is to go beyond the teeth. Dentists are primarily focused on just the teeth. They want to get your teeth done and out. That's where their service ends. But I think they have a bigger role to play to go beyond just ensuring that your teeth is correct, to educating you, because they are the ones in the health system that are actually trained on teeth issues, and they are the ones who have the information. And part of their role should be also educating their patients and their services on what teeth looks like, and how to take care of it beyond just brush your teeth and twice a day. So how else?
And floss. And floss.
Floss,
That's that's the big one that's coming through. Floss and floss. Don't rinse your mouth. It's hard to catch up. Am I allowed another question? Another comment? I just feel like I could just have a chat with Stephen forever. Is that?
Let me have one first.
Okay.
So I think, well, two comments. What you were just saying to Michaela about dentists. I used to have, when I was, I guess, in my late teens, I had a dentist who had much more reactionary political views than I did. And while he had my mouth full of things so I couldn't talk, he was free to talk at me in a way that I didn't really enjoy. But it does seem to me dentists are in a unique position to, now talking at you is not something to do all the time, but it is a way of imparting some knowledge and some information. I think probably there are opportunities there. But linked to that, I think, Stephen, we've spent all morning, and as far as I can tell, nobody's mentioned the word sugar. And I sometimes think, well, it's a question really, would cutting down the sugar be actually more important than having a toothbrush? Now, I don't think anybody can answer that. But the issue of sugar, it seems to me, and it fits with the link with diabetes and some of the work on obesity that we at C3 and many others are involved in. How do we help people? And getting people off sugar is something we're all struggling with, and none of us are succeeding. But maybe thinking about the impact on teeth of sugar might be an alternative way to raise people's awareness and thinking about the harm that sugar, and particularly sugary drinks, can do for people. And then Michaela can come back and have another question unless somebody else nips in fast.
Yes, and I'm really glad that you brought sugar into the conversation. And before I sort of address the sugar topic directly, is to probably mention the diet topic in a more broad spectrum. Is that oral health is almost directly impacted by what we eat, because whether the tooth decays or not is a question of what we eat and then what we do after we eat. And so diets become a very key component to oral health. But most of the time, when the conversations on oral health happen, you would not see it. It would be very rare to see that people mention diets as part of the conversation, like what do you eat, how do you eat it, and what should you eat to support your dental health. I mean, in school, we're taught like you should eat carrots and chew sugar cane, to ensure that your teeth are strong. And that was, the start of the education on diet. And I think then even moving forward as practitioners, that is a component of oral health that we could potentially bring to ensure that the people that we serve also understand that it's very much influenced by what you eat as well. And then coming to the story of sugar, I think sugar might be one of the biggest, if not the biggest, public health challenge that we have for the 21st century. Because sugar contributes to almost all chronic diseases in one way or the other, and certainly oral health has a huge correlation and impact with sugar. And sugary drinks, but also sugary food, and how sugar has managed to be hidden everywhere. And I think one of the key solutions that I begin to offer or suggest when you're talking about sugar and oral health, and especially getting people off sugar, is first of all, simplifying the communication. Is when you talk about sugar, I've found in many cases, we tend to quickly jump into the science and the complexities of it. And the people that we serve might not necessarily be interested in those intricate details. And so how do we help the people that we serve to easily know that this is what sugar is and this is how you can reduce it? So for example, one of the things that we could begin to educate our people is what is sugar, because when you buy sugary drinks, you see, of course, there is what they call sugar, and then they'll hide it in many other different names, still talking about the same thing when you look at the labeling. So we could educate our patients on recognizing those other forms of sugar that exist. And sometimes even saying sucrose, you already lost your patient because they don't understand what that is. But I think it's a role to educate our people on what sugar is. And then more than that is to offer alternatives, because without alternatives, people can't really, people tend to go back to what they are used to. So what alternatives are we offering? What is the better option to say sucrose and fructose and all those hidden sugars in drinks and food products? What are we telling us to see as other alternatives? And things like honey or stevia, for example, begin to come as alternatives. And I think we need to find a collection of, say, like a list of other alternatives to mainstream sugar and sugar products that we could give our patients, so that as we tell them to avoid this, then you could then replace this for that. Because otherwise, if you just avoid, then you probably get back to it because you needed it in the first place. So again, when it comes to sugar, educate on what sugar is and how to read labels. Educate on alternatives and what alternatives exist, and then also simplify the conversation on sugar so that the people we serve know that this is what sugar is and this is how to avoid it and this is its effect on my teeth and oral health and of course all other conditions that come with sugar. So, yeah.
So I think that I've managed to remove Michaela's last opportunity for a question, or anybody else. Really interesting input from Habib from New York University. I'm just asking him from an email contact because we've been doing some work with global health master's students at NYU. Thank you all very much for coming and for great questions. The timing is amazing because the World Health Assembly is debating oral health, certainly this week. I think Habib's message says it's tomorrow. This week in the UK is National Smile Week. I'm not sure if these two are related, but oral health is clearly moving up the agenda. And Stephen, I think your seminar, your commitment, your energy and enthusiasm for the subject is going to help keep it up there. We at C3 will stay in close contact with you on some of the work we're doing. Thank you, everybody, for joining us today. Our next international seminar will be next month and will be on our website. And almost certainly is going to be looking at the issues of obesity and employment. Stephen, a very big thank you to our participants. Thank you very much indeed. Stay in contact with us. If you're not already on our mailing list, please join, and we look forward to seeing you at a future seminar. Stephen, thank you, a big thank you. Bye, everybody.